Prepare to have your health questions answered here on Safe, Effective Natural Solutions with Dr. Todd Binkley, owner of Binkley Healing Center in downtown Ventura. Now, here's Dr. Todd.
Good afternoon. I'm Dr. Todd Binkley, board-certified doctor of non-force chiropractic and practitioner of functional medicine. Alzheimer's and other forms of dementia are always a concern. It's always a challenge. My constant challenge is to remind people how important it is to prevent those things. But what can you do to reduce your risk of Alzheimer's and other forms of dementia? How can you identify your current risk? What are the factors that are testable so that you can know how important it is for you to do something now or earlier than others, perhaps? Everyone's different. Not everyone is going to get Alzheimer's, but far too many people do. And that's always, often devastating, more so for the family members of those who are affected by it than the person themselves a lot of times. But what if you've waited too long? What if you've already been diagnosed, or a loved one, your mother, your father, your brother, sister, spouse has been diagnosed and they can't prevent it. They've already got it. What are you going to do then? I'm very excited to report today that we're going to talk about some new research that has shown something other than the standard drugs that often don't work at all or very little at best to slow the disease. There is some exciting new research on a common nutrient that can is very promising for reducing and even reversing the things that lead up to loss of memory and ability to store new memories that we experience as dementia. And there's a host of other nutrients that everyone should be taking as they get older, or at least test to make sure they're getting sufficient amounts of in their diet to dramatically reduce their risk of the devastating effects of dementia. But before we get into some of these specific nutrients that are often missing as we get older and specific tests that you can run to identify your risk factors, what's most important, the starting point I always like to have people consider is anything and everything you've heard about reducing your risk of heart disease, like exercising, eating a healthy diet, and from any functional medicine practitioner, getting those nutrients. But exercise, I'm going to focus on the exercise first because a lot of people are surprised by that still. Did you know that you can dramatically reduce your risk of any chronic degenerative condition of the brain? So Alzheimer's, all forms of dementia, Parkinson's, and virtually any other condition of the brain, mood disorders, anxiety, depression, schizophrenia, almost anything that affects your brain is going to be, at least in part, as a result of lack of circulation, decreasing circulation of the brain, which results in a deficiency of nutrients. Your circulation is what provides nutrients to your brain, and your brain is the most sensitive organ in the body to even slight minor deficiencies in any nutrients. It's also the most sensitive organ to even slight toxicities of any kind, which we've talked about in previous episodes. We'll come back to that. But let's focus on exercise first. Here's a really exciting article that just came out. Cycling in midlife tied to lower risk of dementia. So this was an article that was published by Dr. Ling Kai Chen in JAMA, Journal of American Medical Association, Network Open. And the title of the article is Active Travel Mode and Dementia and Brain Structure. So this is a study of 479,000 participants over a 30-year follow-up period where they asked everyone, how do you get around? How do you drive? How much do you drive? How much do you take trains? Do you ride your bike ever as transportation? It's an interesting study because a lot of people have an exercise bike or go to the gym and cycle there or do a treadmill. But this was more interested in this. These authors were rightly interested in people who are out moving their body through space in a situation that requires rapid response and thinking. When you're outside riding your bike, you're using your brain in ways that you're not using your brain if you're sitting in a chair watching TV, obviously, but also if you're at a gym riding a treadmill, watching a movie. That's not using your brain very much. You're usually watching or listening to music to distract yourself from the otherwise irritating thoughts that might be in your brain. So when you're out on a road riding your bike, you're using more. This was their idea. What if we test this? Is it true? Could it be true that when people are out riding their bike, does it reduce their risk of dementia and improve their overall brain health. And the good news is, yes, they found exactly that. So this is pretty exciting news. It was data collected from the UK Biobank, United Kingdom Biobank. This is a research facility that collects data on virtually every person in Britain. And this is data that was collected over a 4-year period from 2006 to 2010. And then they analyzed the data 10, 12 years later in October of 2024. And they started out by basically asking them, how do you get around, not to and from work, but all other times? Do you drive? Do you take public transportation? Do you walk? Do you ride your bike? And they did MRI scans to measure the brain structure of these folks, and focusing on the hippocampal volume. The hippocampus is a part of your brain in the temple, just inside each ear. That is the critically important part for you to store new memories. That is always damaged when you have dementia. And so they measured hippocampal volume, the volume of this part of the brain that gets diminished when you have dementia. And oftentimes it's diminished 30%, that part of your 30%. Most of the time when people notice any kind of memory loss or other symptoms of dementia, they've already lost 30% of that part of the brain. So in this study, they measured with MRI scans the hippocampal volume, the part of the brain that gets diminished with dementia, in folks who did cycling or mixed cycling and walking. And the folks that did the active forms of transportation, cycling and walking, they were found to have a reduced risk of all-cause dementia, including young onset dementia, late onset dementia, and Alzheimer's dementia, as well as an increase in hippocampal volume. So this suggests that it's a very promising approach for maintaining brain health. Cycling, especially as a regular form of transport, increases blood flow to the brain, reduces inflammation, and stimulates neurogenesis, the regeneration of new brain tissue. And it requires a higher cognitive engagement. What does that mean? When you're out riding your bike, it requires more work for your brain to pay attention, to make sure you're not going to get hit by a car. And that scares a lot of people. There are ways for people at any age to safely ride their bike outdoors. But no, it's not for everybody, but it's really important. This is really exciting new research. When you're out and about and you have to pay attention to your surroundings and engage with your environment in real time while your body is in motion and your heart is pumping, flooding your brain with all the nutrients that it needs, it contributes to a preservation of the part of your brain that shrinks in absence of that kind of activity. The main part of the brain, the hippocampus, that shrinks when people get dementia, is preserved. And likely, other research, what I'm going to get to here in a minute, is showing that you can even increase it with doing this type of activity. I'm Dr. Todd Binkley. You're listening to Safe, Effective, Natural Solutions to Almost Any Health Challenge. Today we're talking about Alzheimer's and how you can identify your risk factors. And one of the most important tests anyone can do to identify their risk of getting Alzheimer's is the APOE gene test. It's a little bit of a mouthful, but it's a common gene test, APOE, and there are 4 variants of this gene. And so you want to know, do you have the APOE 2, 3, or 4, and you have 2 of each? So the highest risk is if you have 2 of the 4 APOE 4 versions. It's a little technical. Interestingly, I actually can run this test for you. Anyone who wants to run that, it's still kind of expensive. At LabCorp, current price, I just checked it yesterday. LabCorp charges $337 for this gene test. And some people are excited about the gene tests offered by private companies like 23andMe. It's been in the news a lot lately. 23andMe is going through bankruptcy now, and somebody is trying to buy it. And I also heard more recently that the original developer of the gene test program is also trying to buy it. And I went on their website. I did it. I've encouraged a lot of my patients to do it because for $149, you can get the APOE gene test, which costs $337 out of pocket anywhere else or more, and a dozen or more other gene tests, which adds up to thousands of dollars worth of tests you get for $149. So if you're not too worried about that, the 23andMe website is still up. You can still go and order that health gene test profile. It includes tests for clotting factors and a whole host of other things. Hemochromatosis, an iron overload disorder that comes up a lot. Some people are worried about, what are they going to do with my genetic material? Well, who knows? But I think anyone could probably run a pretty good campaign to crack down on them if they did abuse it. And so far, everything has been fine. But anyway, it's really important to know. Why is it important to know if you have the APOE gene? Because if you have the APOE4 gene, you have a 10-fold increased risk of dementia. And if you have the APO4 gene times 2, if you have 2 of those, the risk is 25-fold increased risk. For those people, it's really important to be really careful about doing contact sports like boxing and football and soccer. And even young people that have that gene, there is data to show that they can reduce their risk. It's actually important for anyone that's going to do sports that involves a risk of getting your head bumped to take some anti-inflammatory nutrients like turmeric, or even, worst case scenario, just take ibuprofen to reduce the inflammation that will occur if you hit your head, because even a slight bump dramatically increases your risk cumulatively of getting dementia. So the study that I just cited about the effects of cycling, they did test that on APOE4 carriers, and it didn't have as strong of effect on those people because they have the highest risk. But there is a current study going on at the Cleveland Clinic right now, the Cycle AD trial, and early reports show that sedentary carriers of the APOE4 gene experienced more significant declines in episodic memory and the hippocampal volume, the part of the brain that's so important in dementia, than carriers of the same gene who engaged in moderate physical activity, suggesting that activities like cycling, indoors or outdoors, may enhance the functional and structural integrity of this critical, important part of the brain. Well, here's another exciting study. Various travel modes involve different attention engagement and spatial navigation abilities. So what does that mean? Well, this is research that was done by Dr. Jenna, MD, PhD of Harvard Medical School and Massachusetts General Hospital in Boston, published in December 2024 in the British Medical Journal. A recent study of workers in hundreds of occupations found that those who used real-time spatial and navigational processing skills the most, notably taxi and ambulance drivers, the people that were driving taxis and ambulances out, in the environment where they're having to respond in real time to a whole bunch of stimuli, these folks had the lowest portion of deaths due to Alzheimer's disease. This was an analysis of death certificates in the U.S. of nearly 9 million people who had died with occupational information that allowed them to determine this, and 3.88% had Alzheimer's disease listed as the cause of death. But only 1% of taxi drivers and only 0.74% of ambulance drivers had died from Alzheimer's disease. Equally interestingly, this was a study of occupational information for over 400 different types of work and other transportation-related jobs that didn't require as much real-time spatial and navigational processing, such as bus drivers, for example. Bus drivers are driving, but they don't have to pay attention as much as taxi and ambulance drivers. They ranked 263rd out of, I think it was 433 occupations. So the hippocampus is the brain region used to create these cognitive spatial maps. What is a cognitive spatial map? And when you drive to and from someplace regularly, you form a map of your world. You're just driving to and from work, the places that you drive all the time. You eventually get to a point where you don't even have to think about where you're going. You can just get in the car and go, and you'll eventually get there. And so these are spatial maps that we record in our brain. And ambulance drivers and taxi drivers have to have a lot more of those than most people because they're going to a lot of different places all the time and quickly and under pressure. And so the point of this is it's not like everyone needs to become a taxi driver or an ambulance driver to reduce their brain risk of dementia. The point is understanding that when you use your brain in real-time situations that require you to react in time and process a lot of information, and you do that over and over and over again, that's going to do much more to maintain your brain health than playing Sudoku or doing the crossword. Other studies have shown similarly that, for example, speaking in public or going to a movie with friends and then talking about something controversial afterwards. Basically anything that requires you to think on your feet, to be a little bit uncomfortable, to stretch your boundaries a little bit and react in real time, not in necessarily dangerous ways, especially as you get older. There's easy ways to do this, basically just by talking. That's one of the best examples, and there's good data to show this too. Just put yourself in an environment where you have to think on your feet, where someone's going to ask you a question and you have to respond right now. Go to a Toastmasters group. If you've never been to a Toastmasters group, this is the public speaking organization that trains people. If public speaking terrifies you, some people say it's the number one fear, more than snakes or dying even. It's a really supportive group where you go and everyone else is there for the same reason, to get over the fear of public speaking, and it makes it really easy to develop the skills. And every time you're to your level of comfort, sometimes the first few times you just show up, but eventually you gradually increase your comfort level with speaking extemporaneously, speaking on your feet, speaking about something off the cuff. That uses huge amounts of brain connectivity. It maintains the connections between the remaining nerve cells in your brain so that they continue to work for the rest of your life and dramatically reduce your risk of dementia. I'm Dr. Todd Binkley. You're listening to Safe, Effective, Natural Solutions to Almost Any Health Challenge. Today we're talking about how to reduce your risk and identify your risk of Alzheimer's and other forms of dementia. Anything you do regularly that requires you to think on your feet in real time increases the hippocampal volume in your brain. The hippocampus is the part of your brain that records new memories and figures out where to store them. This is the part of the brain that most often gets destroyed by Alzheimer's. So that's why people who have dementia can experience something and then 5 minutes later they don't remember it. Most people who have normal brain function experience the world as, we see something, we automatically remember it. It's a one-step process. You see something, of course you just saw that, so of course you remember it. But in fact, the recording of memory is always at least a two-step process. A memory comes in, it has to go through the hippocampus, and the hippocampus is the part of the brain that decides where to store that memory. It wants to categorize it and put it in a specific box, someplace where it can find it again later. That's the part of the brain that gets destroyed, that switching station. And that's why people with dementia can see something, hear something, experience something, and then 5 minutes later not remember it because the part of the brain that is required to store that memory is gone or dramatically diminished. And it's also why those same people can remember things that happened 10, 20, 50 years ago. They can remember what happened then because those memories were successfully stored. The problem is it's difficult to store new memories because of the loss of this critical part of the brain called the hippocampus. So we talked about how taxi drivers have better capacity taxi drivers themselves have been shown to have larger hippocampal volume. The part of their brain, this hippocampus, is larger than others. Another study, research led by Eleanor Maguire, PhD of the University College of London, showed several years ago that taxi drivers had significantly larger hippocampus volume than others who were similar in age, education, and intelligence. Well, more recently, in a study published in the Current Biology Journal in December 2011, Drs. Catherine Woollett and Eleanor Maguire, PhD in London, showed that they talked about how London cabbie drivers must pass this rigorous test called the knowledge. So the knowledge that any London cab driver must pass this test requires them to know the irregular layout of about 25,000 streets within a 6-mile radius of the Charing Cross train station, which is the exact geographic center of London. And they have to know the locations of thousands of places. So this spatial learning, known as the knowledge, takes several years to learn. And when Drs. Maguire and colleagues examined the brains of 79 taxi drivers before and after they spent 3 or 4 years preparing for this test, those who successfully passed the test had an increase in gray matter volume in the posterior hippocampus and changes to their memory profile compared with control. So what does that mean? The people who had to take this test and memorize all this spatial information to know where they were in any part of London at any time and know where most of the major locations the people would want to go to when they get into a cab in the center of London. These people had significantly larger hippocampus, the critical part of the brain, than others who didn't. So I mentioned at the top of the show today that there is exciting new research on what can you do. It's all good and well. I'm always telling people, please exercise, get yourself tested, move your body, take some nutrients, make sure that your blood pressure is controlled and that you're keeping your heart strong and you're keeping your pipes clear to keep the blood flowing, prevent plaques from forming, prevent risk of heart disease and stroke. Anything you do like that is going to reduce your risk of all forms of dementia. Most forms of dementia are caused in part, if not mostly, by lack of circulation, by a loss of oxygen, by slow degeneration of that tissue from that loss of circulation, loss of oxygen supply, loss of essential nutrients. So that's all well and good, but what do you do if you've already been diagnosed? What if you already have Alzheimer's or your loved one has been diagnosed with Alzheimer's? So this is a really exciting study published in the Alzheimer's Research Journal, Translational Research and Clinical Interventions in May 2025, just last month. It's a small study, 20 Alzheimer's patients, 60 and up, on medication, the standard medications for Alzheimer's, who received 20 grams a day of creatine powder. Creatine powder is well known among the exercise community. This is the amino acid that is very helpful for building muscle mass. So a lot of bodybuilders take creatine powder. This study used a dose of 20 grams a day split into 2 doses for 8 weeks. And after they did this, they proved, number one, that the serum creatinine values went up from 0.6 to 15 milligrams per deciliter. This is reported by Matthew Taylor, PhD of the University of Kansas Medical Center in Kansas City, and his colleagues. So number one, they proved that taking this did actually dramatically improve, 15-fold or 30-fold nearly increase in the serum levels of creatine when they took the creatine powder. But more importantly, the secondary outcome that they were really going for is the total creatinine in the brain increased by 11%. And this was determined by a special form of MRI called a magnetic resonance spectroscopic imaging, MRSI. This is a special test for imaging things in the brain. And they also showed with a number of metrics that cognition improved on several components of the standard National Institutes of Health Toolbox Cognition Battery. And this is just a group of tests that are used to measure total cognition, fluid cognition, list sorting, oral reading, and inhibitory control and attention. That's kind of a mouthful, but these are just basic ways through interviewing a patient in the office or questionnaires to measure their ability to use their brain. These were all improved by taking creatine. Well, why is that? Well, creatine helps boost metabolism by regenerating ATP, which is a key step in energy production, and the mitochondria, the energy-producing fuel cell in every cell in the body, including the brain. And impaired brain metabolism, including dysfunction in the creatinine system, likely plays a role in Alzheimer's disease. That's what this research is showing. It also might just help reduce inflammation and oxidative stress, which there's lots of nutrients that also help do that. But it's really important. So the new research that's very exciting is creatine powder can very likely reduce your risk of dementia. But it's important to not go out and buy creatine supplements that are full of sugar and stimulants like the junk that a lot of bodybuilders take, the stuff that they sell at most stores. Creatine doesn't taste delicious by itself, so most of these products add sugar, artificial sweeteners that are not good for you, and stimulants, just caffeine or ephedra, guarana, a whole host of other things that you definitely don't want. Just get the creatine itself. If you're wondering where a good place to get it is, email me and I'll tell you. We are running out of time. Thanks again for tuning in. I'm very excited about this new research for preventing and possibly even reversing Alzheimer's. Have an excellent weekend. I look forward to speaking with you again right here next Friday at 2 p.m.
You've been listening to Safe, Effective Natural Solutions with Dr. Todd Binkley. If you have a health question you want discussed on the show, email your health questions to Dr. Binkley at binkleyhealingcenter.com. Take advantage of this opportunity to ask questions for yourself and for your loved ones, because our health matters. Join him next Friday at 2 p.m. for safe, effective natural solutions here on 98.3 FM, The Word.